I'm Dr. Jerry Hesch of the Hesch Institute in Aurora, Colorado. And my client presents with several things. We treated her left ankle, we treated her right SI, her pubic joint, and now we're looking at her elbow. And she's going to describe the injury and when she got the injury, and then I'll show you what I find and how very simple it is to treat. And what she has is a traction, a downward pull of the radius bone. So go ahead and tell us.
Sure. This was actually about 2 years ago that I had this injury. It was after a CrossFit workout that I was doing, and after the workout was over, my husband just gently kind of pulled on my arm to just get my attention, and something in my elbow like really hurt, and it hurt for a couple weeks, and then had very limited mobility when I was bending my elbow. And I've seen 3 different PTs to try and get it figured out, and they did a lot of dry needling of my bicep and stuff in my shoulder, and so that's the story.
Everyone that comes to me now over the last 2 years has had dry needling.
Yeah,
you know, that's now
the go-to, the
latest thing, and I haven't learned how, and I'm not going to.
Yeah.
But anyway, you notice, and the camera's not going to see this, but when I supinate your left forearm, you can see this muscle mass move. Okay, but when we do the same thing over here, it just doesn't move proximally. And you can feel, and I can feel, that I can give a little pull on that radius, and there's a little bit of bounce. And when we do that on this side, nothing. It's already pulled downward at end range. The other thing you might notice is that there's a deeper sulcus here beneath the styloid process and the wrist. So there's more space here. I don't know if you feel that.
Yep.
Okay. And then lastly, this is a nice demonstration. At the count of 3, don't let me supinate your forearm. 1, 2, 3, go. Give it everything. So you're very strong there. And 1, 2, 3, give it everything. And it's easy for me to break. Okay? Now, this is just the first visit. I'll certainly evaluate this again when you come back.
Okay.
But what I'm doing is stabilizing your humerus and just pinching the distal radius and pushing it upwards, which I can do for anywhere between 30 seconds and 2 minutes.
Okay.
It's a very simple, straightforward treatment, and usually has very good, long-lasting results. So that's probably a minute, and I used a moderate amount of force, and now there's a little bit of play. Do you feel that? Okay. So now let's do the strength test. Don't let me don't let me undo it. 1, 2, 3, go. Give it everything. I can't break it.
Yeah, it's way different.
Good. How does it feel?
Feels good.
Is it different?
I don't know if it's any different noticeably from my perspective, but maybe a little bit more mobility here.
Yes. Very good. So we'll stop here, and this is a demonstration of a traction injury to the radius. Most people don't even remember when they heard it, so it was nice to hear your story. Tell your husband I said not to do that. Thank you so much. I really appreciate it.
Yeah, of course.